Hi, Dr. Bauman.
Oh, Jeff. I had someone for you today. I had a patient that was really struggling. I think he was depressed, but he just didn't want to stay and see a shrink. You know, and I was thinking about this as I was typing the note up. I would say the past handful of times when I try to get someone to see you all, they just say no. They just decline.
Yeah.
And it's really frustrating.
Yeah. Well, I think it's a tough conversation for PCPs to have sometimes with patients. Yeah. Let me ask you this. There are a few, I think, key points that if you make them can help that conversation go better.
Okay. Great.
How do you normally talk about my service with patients?
I usually say that I want them to, I'm going to make a referral to our mental health counselor or therapist.
Okay.
Mental health counselor or therapist.
Oh, okay, so you talk about making a referral and you talk about me as a counselor or a therapist?
Yeah.
Okay.
Yeah.
So a couple things you might try instead. One is try referring to me as just a team member. All right.
Okay.
Yeah. When you say counselor or therapist, it can conjure up a lot of different ideas for patients, which may or may not be accurate. So, sometimes providers find they have more success if they describe me as their team member who has expertise in X.
Oh, so be specific about the problem.
Sure. So you can say I have a team member who has expertise with sleep problems, for example.
Oh, okay.
Yeah.
I like that. I like that.
And you can also emphasize to the patient that you really routinely involve me in the care of whatever the problem is. So you can say, I regularly refer my patients who have sleep problems to...
You know, I like that too, because I think sometimes the patients feel like maybe they did something wrong, or this is like...
Right.
Yeah, okay. I
like they're being singled out somehow or something.
Okay.
Yeah, exactly. Yeah. Which can be kind of stigmatizing for the patient.
Absolutely.
Yeah. So,
what about if someone says, I just don't have enough time. I don't have time to see one of you. What do I think then?
Yeah. Well, keep in mind that I can be super flexible with how much time I spend with the patient. So sometimes I'll meet with patients just for 5 minutes or 10 minutes if that's all the time they have.
Should I let them know that?
You can let them know that. Yeah.
Oh, okay.
You can let them know that I can be really flexible with the amount of time. Whatever works for the patient.
Okay.
Yeah, I know they weren't planning on seeing me.
Okay. Oh,
yeah.
That's awesome.
The other thing that can be really helpful to do is to let the patient know that this is going to help you to help them better if you get me involved. Yeah.
Okay.
So rather than kind of singling them out as they're the one that needs all the help, you can say, this is something that would really help me to help you better as your doctor if we could get this team member involved.
Okay. All right. So saying, again, really emphasize the team member. I like that for the kind of patient-centered medical home kind of thing. But the team member helping for a specific problem, that it's a routine part of care, and that it's helping me out. Those are the things that could be really helpful. And
exactly.
Okay.
Exactly.
I'm going to try that out. Thanks so much for talking about this. This has been so frustrating. I'm excited to try this out now. Maybe I'll get a little practice in here too.
Sounds good. Well, let me know how it goes.
Okay.